We've spent the first 10-20 minutes as we went through to the service center, the warehouse, because we realized that a lot of times, even yourselves, you've not been to the facility, so maybe you don't even understand the kind of work that happens here at KEMSA. So I think this part of what we had committed to yourselves the last time we met in Mombasa, and we promised that over time we'll be calling you to engage you on progress within the organization, and also give you an opportunity to ask any questions that you might have, so that we can have a proper engagement with ourselves. I have a written presser, which at the end of it you will each get a copy from our team. So KEMSA, being a crucial entity within our national security institution, responsible for the comprehensive management of health products and technologies, encompassing procurement, warehousing, quality assurance, and the distribution of health commodities. The vitality of KEMSA to our national health and infrastructure cannot be overstated. Its functionality is paramount to the health system's efficacy and consequently to our country's development trajectory. In light of this, the KEMSA board has embarked on strategic initiatives aimed at transforming the authority into a more proficient entity within the health sector. This journey of transformation, initiated by the newly appointed board, began earnestly mid last year and has since made significant strides. The board's focus has been on dissecting and addressing systemic issues that have historically hindered KEMSA's performance. This meticulous approach has encompassed evaluation of short, medium, and long-term strategies to enhance operational efficiency across various domains, notably procurement, finance, governance and risk management, human resources, IT and support systems, warehousing and logistics management. As of mid-February, I am pleased to report that substantial progress across these critical areas, underpinned by strategic reforms and achievements. One, on strategic reforms, on people and human resource reforms. The board's assessment revealed a workforce grappling with demotivation and operational inefficiencies, significantly impeding the authority's ability to fulfill its mandate. This led to a comprehensive review and optimization of staffing levels, transitioning from an unsustainable 734 employees against establishment of 341 to the current 564 employees. Further, the board is working on developing new human resource instruments in the next 3 months to have optimal staff numbers for the authority, further fostering operational agility through strategic role and realignment. So key achievements have been the development of the human resource instruments, comprehensive reshuffles across departments to enhance efficiency, and resolution of all pending staff litigation, reinstating a harmonious organization climate. Secondly, ICT support and systems. Acknowledging the outdated IT infrastructure, the board prioritized a technological overhaul, engaging University of Nairobi Enterprise Solutions to develop an off-the-shelf ERP system designed to modernize KEMSA's operational framework. This was a key achievement that KEMSA had not been able to actualize over the last 11 years. The key achievements: the ERP system's development to support all facets of KEMSA's operations, including e-procurement and e-housing, has already been launched. Automation of performance scorecards and management reporting, enhancing transparency and decision-making processes. And thirdly, establishment of dashboards for order turnaround, stock status, order fill rate, and other management reports for visibility. And this for visibility by management, by the board, and even by the ministry. They're able to see the stock levels that are there and what we are running low on. Thirdly, warehousing and logistic management. Improvements in this sector have been geared towards enhancing distribution efficiency and reducing operational costs, critical for KEMSA's logistic operations. The key achievements: the operationalization of the Kisumu Regional Distribution Centers, which with the official launch on 6th of March 2024. So in 2 weeks, we'll be launching Kisumu as a regional distribution center, being the first regional distribution center for KEMSA. The operationalization of the Mombasa Regional Distribution Center by June of this year. So Mombasa will be our second regional distribution center to be launched in June. A strategic reorganization of the transport system with new tenders expected to bring down the distribution costs from the current 1 billion shillings to 600 million shillings. This is based on the new transport policy that has been adopted by the board, geared towards reducing distribution costs and improving efficiency of the authority's last mile delivery. This means that currently we are doing 100% of distribution through third-party transporters. From May of this year, KEMSA will be doing 40%. The other government agencies will be doing 20%, and we'll only be getting the third-party transporters to do 40% of our business. Fourthly, procurement. The board has instituted comprehensive reforms in procurement practices, aiming to instill fairness, transparency, and accountability, ensuring value for money in all transactions. Key achievements: rigorous review and restructuring of existing contracts and supplier pre-qualification processes. This was aimed at eradicating single sourcing and monopoly actions. Thus, all contracts that did not meet the required threshold were procedurally terminated. Secondly, KEMSA has implemented a revamped supplier pre-qualification process designed to foster competitive bidding and ensure maximum value for money. The board instituted a lotting system in procurement, establishing an upper financial threshold that prevents any single bidder from monopolizing contracts. This strategic move has cultivated a competitive environment across all KEMSA procurement activities. By mitigating the winner-takes-all phenomena, the lotting system distributes procurement opportunities among multiple suppliers for each item, enhancing the diversity and reliability of supply. As a direct result, this approach has significantly improved the availability of commodities and effectively mitigated the issue of stockouts. Thirdly, the introduction of robust monitoring and evaluation framework to bolster procurement integrity. Fourth, the e-procurement module, slated for completion by the end of March 2024, is set to significantly enhance transparency within procurement processes. This technological advancement will streamline operations, ensuring a more open and accountable procurement system. We have revitalized the leadership of the procurement department by assigning treasury staff through secondment and conducting a comprehensive reshuffle of the existing team. Further, we're in the final stages of appointing a substantive procurement director. The board is actively reviewing staffing within the procurement department to ensure dynamic distribution throughout the supply chain, thereby preventing prolonged tenure in a single position. This approach aims to enhance operational efficiency and adaptability. Finally, through targeted stakeholder engagement, including the Suppliers Conference, we have successfully restored supplier confidence and awareness of our procurement reforms. Our efforts are now focused on enhancing the order fill rate, giving priority to the procurement of fast-moving, essential and critical health products and technologies. Critical health products and technologies. Finally, on internal audit. Reinforcing the internal audit function has been paramount, with the board initiating thorough audits to ensure the transparency and integrity of KEMSA's procurement activities. The internal audit team carried out audits of the tenders instituted between July and December 2023 and preliminary reports have been received by the board. This report will inform the authority on 1, areas that require strengthening, and 2, areas that need to be maintained. 6, service to the counties. KEMSA has demonstrated remarkable progress in enhancing service delivery across counties, significantly improving logistical resilience and operational efficiency. The key achievements: successful deployment of the malaria nets to remote counties, showcasing logistical excellence. 2, coordinated emergency deliveries during the El Nino disaster, leveraging partnerships with the Kenya Defense Forces. Thirdly, dispatched over 22.5 billion worth of essential medicine and medical supplies. That's last year. This monumental effort has seen the delivery of more than 86,000 medical products to over 9,000 health facilities, marking a significant milestone in KEMSA's journey to revitalizing its last mile delivery services. The reform initiatives have led to notable enhancements in organizational efficiency, highlighted by a reduction in the order turnaround time for hospitals. And lastly, as of February 2024, the turnaround time stands at 15.8 days, a decrease from 17 days in April 2023. Furthermore, the turnaround time for primary health facilities has improved to 16 days, down from 20 days in April of last year. Additionally, our order fill rate has increased to 62%, up from 49% in March of the previous year. In conclusion, in support of these advancements, as well as in pursuit of the responsibility of guardian of public resources, the board undertook a regular internal audit of the procurement processes so as to identify areas that require intervention or further support. While the audit largely demonstrated that the transformative measures instituted were taking root well, several subpar practices and oversights were revealed which needed urgent redress. This included lapses in formal communication between assigned officers in the procurement process, as well as some disconnects between outputs of evaluation committees and the award process. In light of the results of the audit and with a view to mitigate them, the KEMSA board has adopted the following resolutions that are aimed at charting a new path forward for the institution: enhancing service delivery to Mwananchi and ensuring the taxpayer receives value for the money from our output. 1, the acting director in procurement department was requested to step aside to independently respond to the audit queries that were raised. Secondly, several staff in the procurement department were reshuffled with an emphasis on those who had stayed at one station longest in a bid to infuse fresh thinking and rejuvenation of departments in the directorate. Actually, 23 staff were moved to other departments. And thirdly, commencement of the process of formal recruitment of a substantive director of the Department of Procurement in the institution to enable continuity and long-term planning that arises from security of tenure. As some of you know, KEMSA has not had a substantive procurement director over the last 4 years. So this is the first time that actually we are getting a substantively placed procurement director. Furthermore, we extend our gratitude to the government for its support, including providing 2 billion shillings in capitalization support. This was under the supplementary in December, and facilitating collaboration with KEMSA through the Department of Defense's procurement of health products and technologies. We pledge to keep the public informed about our progress, achievements, and the obstacles we encounter. Transparency and accountability are central to our efforts, and we welcome feedback and suggestions from all stakeholders as we embark on this transformative journey. In conclusion, we want to assure the public that the KEMSA board is entirely devoted to reforming the organization. We understand the urgent need to rebuild public trust, eliminate corruption, improve governance, recapitalize the institutions, and enhance staff morale and productivity. Through these initiatives, we aim to ensure that KEMSA operates with the utmost integrity, transparency, and efficiency, ultimately serving the healthcare needs of the Kenyan people.
Tunaona, tunasikia na tutabonga.